On this edition of the Best Docs Network featuring Forest Park Medical Center, neurosurgeon Jeffrey Cattorini, bariatric surgeon David Kim, general surgeon Tom Roshek, family practice Richard Berlando. Happy holidays, everyone. I'm Candace Kruger along with Jim Knox. We're back again with another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Forest Park Medical Center, as you know, Jim, is one of the top medical centers in all of Dallas-Fort Worth.
And Forest Park Medical Center also has some of the top physicians operating right here, including our first physician. It is neurosurgeon Dr. Jeffrey Cattorini.
Trigeminal neuralgia is a disorder where patients have lancinating pain in their face, typically in one of three distributions, either supraorbital, infraorbital to the nasal region or nose region, or below the mouth to the chin region.
I went to the neurologist for about 3 months, and I wouldn't go the route of, because I am a single mom and ran my own business, so I couldn't be in the drug-induced coma. And I was asking really for a fix. I was like, I don't want to band-aid the problem anymore. I want this fixed.
Laura's case, she had trigeminal neuralgia for almost 17 years, and it initially manifested itself in her early 20s, and she underwent the medication route for multiple years and became ineffective to the medications and intolerant to them.
Well, at first, I thought it was just a toothache. It felt kind of like having your teeth drilled without Novocaine. And then it moved into the whole side of my face.
Basically, neuralgia is nerve pain. And if you think that patient has nerve pain, you treat it typically with seizure medications.
The actual nerve is about the size of a wire to your headphones to your iPod. What he did is cushioned the trigeminal nerve and then put me on back together again. And now my typical day is I go to work, I have a full day of work because I have my energy back. I get to come home and I go to dinner with my kids and we watch a movie and we're up till 10 o'clock at night after homework and everything, and it's a real day back again.
Laura had a good result from the surgery. We weaned her off the majority of her medications by 3 months post-operatively. She had some incisional numbness around her incision site, but she's much more functional, much more happier than she was preoperatively.
The pain is gone, and it's gone for good. He recognized that it was something that needed to be taken care of right away and didn't make me go through a bunch of red tape, just took care of it.
Infertility itself is tough enough to experience alone. A lot of patients do feel like they have nowhere to turn to, but fortunately, we're here in the community. We're lucky that at Dallas IVF, we have a one-stop shop type of center where the patient can come and receive a whole wider range of treatments and to help them get pregnant.
Some couples come to us because there's a male factor, sperm is poor. Some couples come to us because the woman has endometriosis or does not ovulate well. There's a whole range of reasons why couples come to us. About 15% of the patients we see in the office have what's called unexplained infertility. They have a completely normal workup, yet they're still unable to conceive.
Here at Dallas IVF, we offer a wider range of infertility treatments, ranging from basic aggressive therapy like taking medicines such as pills to grow an extra 1 or 2 eggs, combined with something called insemination or IUI. That's where we'll take the partner sperm and place it closer to the eggs within the uterus. Another treatment that we offer is a very aggressive treatment called IVF, also called in vitro fertilization. What that is where everything that occurs in the tube, which is particularly fertilization and embryo development and growth, all that occurs in a glass dish in the lab. So in that way, we can actually find the healthiest embryo and place those back into the uterus.
If there's a structural reason why they can't conceive, the tubes are blocked, there's fibroids, polyps in the uterus, endometriosis, for these people, we often have to take them to the operating room and try and correct those abnormalities. We're fortunate we operate at Forest Park Medical Center at Frisco, which provides the full range of services that we need on all our surgical patients.
Infertility and infertility treatments is like an emotional roller coaster. Hope and excitement followed by despair and frustration, followed by hope and excitement. But one day, there will be a little baby at the end of the road. It's so rewarding, especially when the families come back and they are so excited to show us their little child. It really is the best part of what I do.
Anne was suffering from severe sinus problems, and she credits Dr. Colin Perro for helping change her life. To find out more about Anne's story and other life-changing stories, log on to bestdocsnetwork.com.
We're here at Forest Park Medical Center of Dallas, where we are a bariatric center of excellence through the American Society of Metabolic and Bariatric Surgery. What a bariatric center of excellence is it's a designation that a facility has to actually apply for. It covers 10 very vigorous standards that are set forth from the American Society for Metabolic and Bariatric Surgery, and they actually come and interview, they audit charts, they look at outcomes, and they look at 10 very vigorous standards to make sure you meet those standards, from the equipment you have to care for your patients, the personnel that you have involved taking care of the patients. And it's there for patients to be able to select a facility that is above and beyond for their care of bariatric patients.
Part of being a bariatric center of excellence means that we're able to handle any complications that occur with our patients. So we have several physicians that we can consult for whatever needs we may have, whether that be pulmonology, nephrology, neurology, any of those things that we may need. We have those here at our fingertips, and we have that for the ICU and the ER as well.
I oversee all of the medical nutrition therapy both before and after surgery with the bariatric patients. So up to 6 months prior to bariatric surgery, patients can come and see us and work on lifestyle changes. And then we also visit with the patients here in the hospital immediately after surgery, and we offer post-op classes just to kind of keep everybody on track up to a year following the procedure.
I help teach the pre-op and the seminar classes for our bariatric patients or our prospective bariatric patients. We do inpatient teaching after they've had surgery, as well as do the lap band adjustments once they've had surgery. We do upper GIs. We do see them from prospective patients, and post-op wise we see them throughout the whole course of their procedure, as well as 2 years out, 3 years out, so we continue to follow up with them and see how they're doing and continue their education.
The pre-op procedures that we do in radiology are the upper GIs, and they like to do that to be able to see the intestinal tract before they have surgery, so the doctor knows what they're working with. And then post-op, we bring the patients down and we do upper GIs so that the doctor can make sure that all the suture lines look good and there's no leaks and everybody's good to go home.
We do around 3% of the cases nationally for bariatric surgeries. That means that out of all the thousands of bariatric surgeries nationwide, this specific hospital does 3% of them.
We have a great multidisciplinary team, and we do have a great team of our dietitians, our nurses, our surgical staff, our respiratory therapists, physical therapists, radiology techs, everyone. And it takes every one of those members of the team to provide great patient care. And without any one member of the team, we couldn't be as effective as we are.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
Not only is Forest Park Medical Center one of the top medical centers in all of Dallas-Fort Worth, they also have some of the most amazing physicians. Like our next doctor, it's Dr. David Kim.
Erin's a lovely 27-year-old who struggled with her weight pretty much throughout her entire young adult life. And so after lots of different things like diets that exist and diet pills, she was not able to lose weight.
Before I came to see Dr. Kim, I was starting to have some health issues. I had thyroid issues, I was borderline diabetic, and I was ready to do something about that before they became major health issues. I was already starting to take medications that I didn't feel like I should really be on at my age.
Erin and I sat down and chatted about the different options that were available for her. She chose gastric sleeve surgery, and this was a great fit for her because she has a very active life.
What really drew me to this sleeve surgery was that there was no device that would be implanted into my stomach, and it was not as extreme as the gastric bypass.
The operation allowed her to lose a tremendous amount of weight. In a year, she lost almost 100 pounds, and she was able to then have a life that everyone wants to have as a young person.
Once I started seeing the results, I was really motivated to keep going and to keep eating healthy and to keep going to the gym every day, and just mainly the results are what really keeps you going.
Sleeve surgery, though the operation does entail physically reconstructing someone's stomach, what a patient is required to do after surgery would be nothing different than what other people are expected to do, which is to practice portion control as well as wise nutrition choices and trying to get some exercise every day. And when they do these practical steps along with good sleeve surgery, patients can do marvelously well.
When I go shopping, you know, people are actually interested in helping me. The people in the stores now, they're more willing to help me. They pull clothes for me, and shopping is fun. I don't have to go to specialty stores anymore, and I can wear heels. Before I could never wear high heels, and shopping is just a lot of fun for me now.
Did you know that Forest Park Medical Center Dallas has the AccuVein Vein Finder? This allows the phlebotomist to actually see the vein before drawing your blood, eliminating multiple sticks.
I lived on a farm my life most of the time, and I did hay work. We had cattle, we had hay fields, we had gardens, we had truck patches and things like that. And I worked in the gardens and hoed and plowed and ran a hay baler, anything that's strenuous to a lady. So I think what happened to my shoulders, I just wore the bones out. You know, I couldn't lift my arms, the pain constant, day and night.
She had previous rotator cuff repair, which because of the severity of her tear, was not able to be completely repaired, and the rotator cuff eventually completely failed and it was no longer functioning.
So I finally went to Dr. Aldrich, and Dr. Aldrich checked my arm and shoulders and bones out, and he said I was eat up with arthritis. And Dr. Aldrich did a reversal shoulder surgery.
Here is a standard shoulder replacement. Ball socket, just like our natural shoulder is. We have a ball on the top, we have a socket here, they go together. A reverse is just that. We have now reversed the relationship. So where there used to be a socket, we have a ball. Where there used to be a ball, we have a socket. What that's done is it's lowered the humerus bone down lower. It used to sit up higher. It's down here, and that's put extra stretch on the deltoid and allows that deltoid to substitute for the rotator cuff and to elevate the arm. And the rotator cuff used to hold the humerus down lower. Rotator cuff's not there anymore, so this relationship is what's holding that down lower and keeping the humerus lower so that you can do this thing.
I had the surgery on November the 15th of 2010. I cooked my first full meals on December the 19th, Christmas, for 21 people.
She has literally normal motion of her shoulder as if she had never had anything wrong with it.
I've done really well with it all, and I didn't think I would ever touch my head or my back, but I do.
When it comes to developing gynecologic cancer, Dr. Jonathan O has a few reasons how it develops.
For most gynecologic cancers, they're what we term sporadic, meaning that there's no familial disposition, there's no genetic link. So about 85% will just be sporadic, but the small percentage will be hereditary.
When dealing with gynecologic cancer, there are signs and symptoms to watch for that are associated with the three most common cancers. First, ovarian cancer.
For ovarian cancer, the signs and symptoms are very generalized. And when I say generalized, what I mean is that the symptoms are not specific to what you would think would be gynecologic cancer. So the most common complaint that women will have for ovarian cancer is bloating and distension. So it's not pain, it's not any problems with what they feel like is their female organs, but it's just feeling bloated. Oftentimes people come in saying that they just can't eat as much, they feel full really early, they feel like their bellies are getting bloated and their clothes are fitting more tightly. And these are problems that just persist and progress over time.
Another form of gynecologic cancer is uterine cancer, which is common among both older and younger women.
The most common sign for uterine cancer is postmenopausal bleeding. So if a woman generally over 50 who's done having periods starts to have any bleeding, then she should seek medical attention because that's a very, very worrisome sign, and that's the most common sign for uterine cancer. The most common sign for uterine cancer in a young patient would be heavy vaginal bleeding. So if you have bleeding that's much heavier than your typical period and this persists over several weeks to several months, then that warrants an evaluation and biopsy.
Now to the third common gynecologic cancer, which is cervical cancer.
The most common symptom for cervical cancer is abnormal bleeding. And oftentimes this will present as what we call postcoital spotting. And postcoital spotting is just a fancy term for spotting or abnormal bleeding after intercourse. What will happen is that the cancer will develop on the cervix with what we call trauma, and trauma could be intercourse. It stirs the cancer up and causes it to bleed, and women will present complaining of bleeding.
If you are having any of these signs and symptoms, please consult your physician. For more information on Forest Park Medical Center, and of course all the outstanding physicians that operate right here out of Forest Park Medical Center, head to the website bestdocsnetwork.com and click on Forest Park.
And up next, our next best doctor, it's General Surgeon Dr. Tom Roshek.
A hernia basically is where your tissue will stretch out and it will allow other tissue to bulge through that, and it can actually get stuck to the tissue that it was bulging through, and that's where you see a hernia. The hernia can happen in the groin, it can happen in your abdominal wall, so really anywhere the tissue stretches, allowing something to bulge through, that basically is a hernia.
Got back from a wonderful cruise where we were very active. Had a wonderful time, but I had a place in my belly button, near my belly button, that was bulging, and I knew something was not right. Dr. Roshek discovered that it was an incisional umbilical hernia and said I needed surgery to repair it.
The most common symptoms that we see from hernias are actually very non-specific. So a lot of times a patient will say, I have a fullness, or I have a feeling of discomfort in this general area. The most common thing we actually see on the body is a bulge. Pain is actually a symptom that you should watch out for. If you're having sharp pains or pains that are not getting better over time, that's a sign that something may be caught inside of the hernia and needs to be addressed immediately. It's hard for us to say what actually causes hernias. There are several factors. I think the main component of the tissue stretching out is your genetics.
Went in to see Dr. Roshek, and I knew I was in a wonderful place when he greeted me at the door and welcomed my husband in. One of the first questions I asked Dr. Roshek, is this the treatment that you would give your own loved ones if they had the exact diagnosis that I did? And he said, absolutely.
Once I see the patient in the office and we diagnose the hernia, then we have to decide how we're going to fix the hernia. And there are basically two different techniques, the open technique and the laparoscopic technique. After surgery, the recovery period for the patient is going to be determined on how big the hernia was, how long the surgery took, and the location of the hernia.
Recovery time, it wasn't easy, but it wasn't too long before I was back to my active lifestyle. Busy preparing to enter nursing school, had lots to do. Dr. Roshek's personality, his calmness, his demeanor gave me great confidence in having surgery with him.
Brothers Brock and Brady experienced multiple injuries due to sports. They credit Dr. Stephen Michelson, who got them back in the game. To find out more about this story, log on to bestdocsnetwork.com. Today's Ask the Doctor comes from Eric. Eric has a question for Dr. James Davidson. The question, how soon after bariatric surgery can I expect to see the diabetes go away?
People ask how fast is their diabetes going to be improved with either a bypass or a sleeve? The answer to that is it's going to be improved faster with a bypass. And they may, if they don't have real severe diabetes, they may leave the hospital throwing away their metformin or their diabetic pills. With a sleeve, it may take longer. It may take a few months to both have a little weight loss and have a cumulative effects of the metabolic changes from a sleeve to resolve their diabetes. So my recommendation is if somebody wants to resolve their diabetes as fast as possible, you're probably better off to have a bypass.
For more information on Forest Park Medical Center and the outstanding doctors that operate right here out of Forest Park Medical Center, log on to bestdocsnetwork.com and click on Forest Park. Now it's time for our next best doctor. It's Dr. Richard Berlando.
Dr. Berlando's been my physician probably for 10 years. I just went to him originally to have a physician to go to, and then I started having physicals on a yearly basis. And about 4.5 years ago, on one of my routine physicals, Dr. Berlando discovered that my PSA was high. So he sent me to a urologist. They did some tests, including biopsy, and they discovered I had prostate cancer.
In Jane's particular case, there was a change in what's called the PSA velocity, the prostate-specific antigen blood work. What we were able to identify, there was a significant change in that from the previous study. And again, that's the importance of follow-up, so you can kind of compare that every year to year and a half to make sure that it's not going up too quickly. That was one of the key indicators that got him into the specialist to make the early diagnosis of prostate cancer. Early detection is really the key. That way we'll have better outcomes. The patient has a wider variety of different treatment plans to choose from that way, and it just works all around much better.
He's a good doctor. You can tell he's concerned. He spends time with you in the room. He doesn't just rush in and rush out. I believe is concerned about his patient's well-being, and he's just generally a good guy. He's knowledgeable, takes good care of me. He's concerned about my health.
We've had people that are feeling well, but they just come in just for a little routine exam and didn't realize it, but they are a walking time bomb. And again, explaining to them how aggressively this has to be dealt with from the get-go. Again, we're going to be with you every step of the way, making sure that whatever medication we use is not going to be harmful to you, and showing you the benefits of that. Again, making sure that that patient does follow up, so we've got good systems here in the office to make sure that we follow through with that.
If I hadn't visited Dr. Berlando, he hadn't been doing the physicals on a yearly basis, performing the PSAs, I wouldn't have known about it. Like I said, I would have probably found out about it very late in the game, which would have probably been too late to do anything for me.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
After Kemper was born, he had a newborn hearing test at the hospital, so we were taken to several other doctors to find out more about his hearing and hearing loss. We'd heard about getting cochlear implants and had done some research on them, and that's kind of the road we decided that we wanted to take.
A cochlear implant is truly a bionic ear. It is the only available full replacement for a human special sensory function.
When he was born, we found out in the hospital before we even left. You know, it kind of took the joy and excitement out of having a baby. You know, all of a sudden told that there may be a potential problem with your son. Because, you know, nobody wants to find out that something is, you know, wrong with their child, especially our first child.
It's a day surgery type procedure typically. Maybe small children and babies would spend the night. But this surgery takes no more than about an hour and a half to 2 hours to do. That portion is allowed to heal, and then a very specialized computer is used on the outside called the processor. And that processor takes all the sound in the environment, digitizes it, and sends it to the implant via an FM signal.
And when they first turned him on, he'd never ever heard sound. So they started him off very quietly and slow, so not to scare him, you know, because it's a whole new world to him.
And the second that we had our first appointment with Dr. Peters, he said, okay, you know, my staff will take care of everything, and they did.
In the case of Kemper, who was identified early and whose parents wanted to be very proactive, very aggressive in doing everything they could for him, they presented early on so that by the time I saw them and that we had completed all of the evaluations at 9 months, not only was he ready for an implant, but I felt he was old enough and he had grown enough that we could do both ears at the same time.
It really has changed his life. He turned into a different baby. He was just a lot happier, and it's just like his whole world kind of opened up.
But yeah, we think very highly of Dr. Peters.
Before I had a chance to get with Dr. Hung, I was kind of suffering with allergies pretty severely, whether it be like sneezing or not being able to breathe or not being able to breathe without opening my mouth. And then also every time I would sneeze or have any allergic reaction, anything, it would swell up so severely it just no air could pass through. And so I had gone to multiple allergists my whole life.
Jennifer came to me because she was primarily experiencing nasal obstruction. It had been going on for most of her life. She did not have any clear history of any nasal injury or any accidents in the past, but she found that she was unable to breathe from both sides, but it seemed like her right side was more affected. And after years of medication, and she still wasn't getting the relief, and she still felt like she wasn't breathing as well as she should.
We talked about if I wanted to do rhinoplasty as well, which I ended up doing because I did have a hump, and then they straightened it out, but I also wanted to not let it look like I had had my nose fixed, if you will, and so he just took my bump out and then corrected my septum, which kind of straightened everything up.
The surgery entailed straightening out her septum and shrinking down the turbinate to create more room in both the right and left sides of her nostrils. I also used some of that septum to create some grafts to help support the nose, because part of Jennifer's problem was that the framework of the nose was starting to shift and collapse, contributing to her nasal obstruction. And so I used some of her septum to help re-support the nose.
You can make it as big a deal as you want, but for me personally, my recovery time was nothing. There was only upsides for me.
A lot of people just go through most of their lives really not knowing sort of the potential of how well they can breathe through their nose. It's very hard to sort of be able to mimic with medications or anything like that what it's like to sort of optimally breathe.
It was literally one of the best things I've ever done.
Thanks for tuning in, everyone. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center, of course, one of the premier medical centers in all of Dallas-Fort Worth.
For more information on Forest Park Medical Center and, of course, the outstanding physicians that operate right here out of Forest Park Medical Center, head to the website, bestdocsnetwork.com, and click on Forest Park.
And as always, if you have a question or comment for us, we would sure like to hear from you. Send us an email at info@bestdocsnetwork.com.
All right, that'll do it. Happy holidays again, everyone. We will see you next week.